All right, we're already up to Medicare Advantage, which is Medicare Part C. Getting back here to the book for a second, we're going to go to page 57 now. We started off on page 15 that they gave you the 2 ways to get your Medicare, and it was real simple. Here we have the exact same thing, but it's a little bit more complicated. There are 2 main choices for how you get your Medicare coverage. Use these steps to help you decide. We've discussed original Medicare already. Includes Part A and Part B, hospital medical insurance. Medicare provides this coverage directly. You have your choice of doctors, hospitals, and other providers that accept Medicare. That's not something we talked about yet. Over here under original Medicare, folks, one of the advantages to being on original Medicare is you can go to any doctor, any hospital. If they accept Medicare, you can go there. We're going to learn here, though, under Medicare Advantage, you have networks of doctors that we'll talk more about in just a second. Generally, you or your supplemental coverage pay deductibles and co-insurance. You usually pay a monthly premium for your Part B, which we did not talk about yet. It's currently $99.90 is for most people. If you're in different tax brackets, you're going to pay that $99.90 premium for Medicare Part B, which is, again, the doctors. That's your Part B premium. Whether you're on original Medicare or Medicare Advantage, you have to have Medicare Part B to have a supplement or to have a Medicare Advantage plan. So you're going to pay that $99.90 out of your Social Security either way. Now, let's swoop over here, though, and let's take a look at the Medicare Advantage plan. And then we're going to put the book down, and I'll explain it in just plain, simple English. Part C, which is Medicare Advantage, includes both Part A and Part B. So one of the things I like to put to rest is if you go into a doctor's office, sometimes you'll hear that somebody in the billing or one of the nurses or somebody say, "Oh, that's a Medicare replacement." No, it's not Medicare replacement. That's a term from back in the 80s with things they had back then before standardization. Medicare Advantage is Medicare. You still get your Medicare Part A, your Medicare Part B. It's not Medicare replacement. However, the reason they think that, and we'll understand more in just a second, is as we read on, you see it says private insurance companies approved by Medicare provide this coverage. So that's where the confusion comes from. We'll explain that more in just a second. But private insurances are going to provide the coverage as opposed to the government. I'll explain. In most plans, you need to use plan doctors, hospitals, or other providers. You may pay more cost if you go out of network. That's pretty much it there. So you can read on through here from page 70 to 81. They go through all of the details of Medicare Advantage, but I'm going to explain it to you in just simple English so you understand what it is you're reading when you go on to read. So first of all, the easiest way to understand Medicare Advantage is to compare it to original Medicare, and then you can see the differences. So just to review, under original Medicare, we're going to play a little game. You have 3 choices. The government is going to, and the insurance company and you, we're going to pay one of these 3 things. So first of all, under original Medicare, the government pays the claims, the benefits, whatever you want to name it and term it, that's what the government pays. So under original Medicare, the government will pay the claims. However, the insurance company with your Medicare supplement, what are they going to do? They're going to pick up your co-pays and your deductibles, because that was putting us at risk for a tremendous amount of money with no lifetime maximum. But in order to have this insurance, you will pay the premium. And that's for your Medicare supplement, and that's how original Medicare works. Now, Medicare Advantage works differently. Back in 2006, the government said, look, why are we trying to pay claims? We're a government agency. We have all this waste, fraud, and abuse, and people are sending us in claims for doctors that don't even exist and people who have been dead, and we're just paying them because we don't know. But the insurance companies, they already have those computers in place. They're already working with the doctor's offices. They're already working with the hospitals, and we can cut down dramatically on our waste, fraud, and abuse if we'll outsource the payment of claims to the insurance company. So over here, under Medicare Advantage, the government does not pay the claims. That's why people get confused in doctor's offices and call it Medicare replacement when it's not. It's because they're sending the bill to an insurance company as opposed to the government. But under Medicare Advantage, the insurance company pays the claims. And it works very nicely. Under Medicare Advantage, when you go into the doctor's office, you won't give them your Medicare card. You'll give them your Medicare Advantage card that will have the name of a company on it. And again, folks, we represent multiple companies here. You know their names. You hear them all on the TV and the radio all of the time. But regardless, we pick out the one that's right for you. We'll learn more about that in a second also. So under Medicare Advantage, the claims are paid by the insurance companies. Now, the government said, you know what? If the insurance company is paying the claims, what we're going to do is we're going to turn around and we're going to pick up the premiums. Because over here, you pay the premium, but over here, the government will pay all or most of the premium. Most of the time, Medicare Advantage plans have a $0 premium or a $15 a month premium or a $20 a month premium. That's because the government is paying all or most of the premium. If it's a $0 premium, they're paying all. If it's a $15 a month premium that you pay, the government's paying most. They're paying all but 15. And I also said it depends on your plan. These plans, Medicare Advantage plans, are not by state. They're actually by county. That's a very big difference. You could have, you know, a town here on one side, they cross county lines, and that plan's not available anymore. So it's important to know what plans are available in your county. And also you want to make sure that you get a plan that your doctors and hospitals use and they cover that network. Here in Missouri, I live down by the Springfield area south of there, but we have two major networks here. And people are in this one or people are in that one. Which one is it? And then they determine which Medicare Advantage plan that they want from there. So that's how it works. It's by county. The government pays your premium. The insurance company pays the claims. So the only thing left for you to pay is the co-pays. Now, there's major differences here between original Medicare that the insurance company pays the co-pays and there's percentages and there's no maximum amount of pockets and you don't ever know what your bill is going to be and it'll bankrupt you. That's not what we're talking about. Under Medicare Advantage, when the government pays the premium, the insurance company pays the claims, you'll pay the co-pays, but they will give you a book like the one I'm holding in my hand that's called a summary of benefits. And the summary of benefits, unlike the government book that we learned back in Part A, that if you read on the back cover says that 2012 premium deductible amounts were not available, the insurance companies, those evil insurance companies that are protecting you from the government, are required to put out a summary of benefits in like September. So you know during opening, or maybe it's even earlier than that, July, I don't know when. But they do it way early in the year. So you know what your co-pays and deductibles are going to be exactly in the upcoming year, and there's no guessing, and they're all manageable. I'm going to give you some examples. This is just a plan that I picked randomly here, ripped off the company names so you can't see them. But when you open up your summary of benefits, and I'm going to give you some examples here on the board, the first thing it tells you is you have to pay your monthly Part B premium, which we've already talked about. That's that $99. Okay? So you always have to pay your Part B premium, and then it's going to tell you if there's a premium for your Medicare Advantage plan. This particular plan does not have a premium. By that, it's a $0 a month premium. Some, you know, you can see them generally as high as $25. Some go higher, and I've seen them as high as $100. There's reasons why they're that high, but generally most people are going to stay down here in this area. So in the summary of benefits, that's what you'll be looking at. Under your summary of benefits, it's going to tell you what your co-pays are and your premiums. So first of all, we learned that we don't have a monthly premium here. The government's paying all. Then it gives you a choice. It tells about your network. You have to stay in network. But when you get to number 3, this is the big one that people want to see. Okay, if I go in the hospital, and if I'm in the hospital in my worst case scenario, we learned under original Medicare Parts A and B, man, I could have $44,000 for this and 20% for that, and it could be thousands and thousands of dollars. We don't have that over here. When you go into the hospital under Medicare Advantage plan, it's going to give you a copay per day, up to so many days, after which time it goes to a $0 copay. This example I'm using here gives us the example of if you were to go into the hospital under this plan, you would have a $205 copay for each day you're in the hospital up to, or for days 1 through 7. So you would know that your worst case scenario, 7 is 35, would be $1,435 if you were to be in the hospital 365 days, because when you reach the 8th day, it goes to a $0 copay. So this would be an example how your summary of benefits would show you under Medicare Advantage plan. Look, if you go into the hospital this year, you're going to have to pay $200 for each day you're in the hospital up to X amount of days. That would be your total, and then after that it would be 0. That's manageable stuff. As you go on through your summary of benefits, you're going to see things like the doctor's office. I'm going to point out to you the important ones. This one has a $0 copay. A lot of times, in fact, most of the time, your well-care visits are $0. But more often than not, when you go to the doctor's office on these things, you're going to see like a $5 copay or a $10 copay for a doctor's office visit. If you have to go to a specialist, you may see a $45 copay. The other ones I tell people to watch out for and look for, the big one is outpatient surgery. Folks, there is a big company out there that every one of you knows their name. Everybody's seen the commercials. But when you look at their Medicare Advantage plan, it is a percentage. You want to stay away from that. That is not good. It's a percentage for the outpatient. For instance, my father had his stents redone in his heart. $11,000. If he'd been responsible for 20% of that, that would have been over $2,000. But instead, he's enrolled in a Medicare Advantage plan that has a fixed dollar amount for the outpatient surgery, and his copay for that $11,000 procedure was something in the neighborhood of, say, $300. So that's how Medicare Advantage works, folks. It's different than original Medicare. It's very unique. Again, there's networks that you have to stay with. You need to know what your copays are going into the year. But most of my clients, when they look at original Medicare and Medicare Advantage for one or two different reasons, end up with a Medicare Advantage plan. We're going to finish up Part D here, and then when we finish Part D, we're going to go back, and I'm going to talk about original Medicare and Medicare Advantage and understanding and knowing which option is the right for you. And when you watch that and listen to it, I think it'll be obvious to you which way is the way to go and why. So thanks again. That's Medicare Part C. We're going to finish up with Medicare Part D, and we're almost there, folks. Thanks.